Hi everyone, and welcome to my Patreon, the Spoony Life and Beyond, and my name is Sarah. So welcome to our first awareness post. So this has been requested by one of our members, and it is on cystic fibrosis. So I am actually blind. I rely on text to voice, so sometimes I do get a little bit jumbled up and I need to re-find myself, and I quite often don't actually look at the camera properly, so I do apologize. I do try my best. So I'm going to jump straight into it, and then at the back of the last part of the video, I'm going to go into a few more bits and pieces about our Discord and a few more things that are going to be happening. And I do apologize if you hear cats and dogs in the background because they're a little bit cray-cray this morning. So let's get started. So our post of awareness today is cystic fibrosis, and it's also known as CF. So it is a condition passed down in families, and it causes damage to the lungs, digestive system, and other organs in the body. It affects the cells that makes mucus, sweat, and digestive juices. So these fluids, also called secretions, are usually thin and slippery to protect our body's internal tubes and ducts and make them smooth pathways. Whereas with people with CF, a changed gene causes the secretions to actually become sticky and thick. So the secretions then plug up the pathways, especially in the lungs and the pancreas. So CF gets worse over time and needs daily care. But people with CF usually can go to school and work. They often have a better quality of life than people with CF decades ago. Better screening and treatments mean that people with CF now live into their mid to late 50s or longer, and some are diagnosed later in life. So the symptoms, when it comes to symptoms in the US, because of newborn screening, cystic fibrosis can actually be diagnosed within the first month of life. Before symptoms even develop. But people born before the newborn screening became available may not be diagnosed until the symptoms of CF actually show up. So CF symptoms vary depending on which organs are affected and how severe the condition actually is. And even in the same person, symptoms may worsen or get better at different times, so they could flare and settle over different periods of time. And some people may not have symptoms until their teenage years or even adulthood. So people who are not diagnosed until adulthood usually have milder symptoms and are more likely to have symptoms that aren't typical. And these may include repeated bouts of inflamed pancreas, called pancreatitis, infertility, and repeated bouts of pneumonia. So people with CF have a higher than usual level of salt in their sweat. Parents often can taste the salt when they kiss their children. Most of the other symptoms of CF can affect the respiratory system and the digestive system. So with the respiratory symptoms in CF, the lungs are most commonly affected. So the thick and sticky mucus that happen with CF clogs the tubes that carry air in and out of the lungs. This can cause symptoms such as a cough that won't go away and brings up thick mucus, squeaky sound when breathing, wheezing, limited ability to do physical activity before becoming extremely tired, repeated lung infections, irritated and swollen nasal passages or a stuffy nose, and repeated sinus infections. So when it comes to the digestive system, The thick mucus caused by cystic fibrosis can block the tubes that carry digestive enzymes from the pancreas to the small intestine. So without these digestive enzymes, the intestines can't completely take in and use the nutrients in food. So the result is often foul smelling greasy stools, poor weight gain and growth, blocked intestines, which is more likely to happen in newborns, and ongoing and severe constipation. Straining often while trying to pass stool can also cause part of the rectum to stick out of the anus, which is called a rectal prolapse. So it is quite complicated. It comes along with a lot of symptoms that, you know, are not pleasant. They're not easy to deal with. It requires a lot of follow-ups. You know, if there's any differences that you notice in your children or your family member who has CF, you know, obviously reach out to your medical team, you know, because this isn't a post for medical advice. It is for awareness purposes only. So please do, if you're worried at any time, do reach out to your medical team. So the causes of CF is a change in a gene that causes problems with the protein that controls the movement of salt and water in and out of cells. So the gene is the cystic fibrosis transmembrane conductance regulator, or CFTR gene. It affects the cells that make mucus, sweat, and digestive juices. So when the CTFR protein doesn't work as it should, the result is thick, sticky mucus in the respiratory, digestive, and reproductive systems, as well as extra salt in sweat. So changes in the CTFR gene that cause CF are divided into several different groups based on the problems they cause. Different groups of gene changes affect how much CFTR protein is made and how well it works. So to have cystic fibrosis, children must get one copy of the changed CFTR gene from each parent. If children get only one copy, they won't actually develop CF. But they will be carriers. And they could pass the gene on to their own children. People who are carriers may have no symptoms of CF or a few mild symptoms. So the risk factors of having CF is a condition which is the condition that's passed down in families. You know, that is a risk factor in itself, is knowing the family history. So CF occurs in all races. It is most common in white people in the Northern European ancestry. So because it is less common in people who are Black or Hispanic, Middle Eastern, Native American, or Asian, this might lead to a much later diagnosis. A later diagnosis may cause worse health issues, so early and effective treatment can improve the quality of life, prevent complications, and help you live longer. If you're a person of colour and have symptoms that could be CF, you know, really look into it if you're worried. Second opinions, also options as well. So the complications of CF can affect the respiratory, digestive and reproductive systems, as well as other organs. So the damaged airways is one of the leading causes of damaged airways for CF. A long-term lung condition called bronchiectasis. Bronchiectasis, sorry, I do apologize, results in widening and scarring of the airways. So this makes it harder to move air in and out of the lungs and clear mucus from the airways. So there's ongoing infections, so thick mucus in the lungs and sinuses make a place for bacteria and fungi to live and grow. So sinus infections, bronchitis and pneumonia are common and may happen repeatedly. Infections which bacteria that don't respond to antibiotics and are difficult to treat are very common too. So growths in the nose, because of the lining inside the nose are irritated and swollen, it can develop soft, fleshy growths called nasal polyps. Coughing up blood is from the bronchiectasis, which can occur next to blood vessels in the lungs. So the combination of airway damage and infection can result in coughing up blood. This is only a small amount of blood, but rarely it can be life-threatening. So you can also get a collapsed lung. So it's called a pneumothorax. This condition happens when air leaks into the space that separates the lungs from the chest wall. This causes part or all of the lung to collapse. Collapsed lung is more common in adults with CF. Collapsed lung can cause sudden chest pain and trouble breathing. People often have a bubbling feeling in the chest. So there is also respiratory failure. So over time, CF can damage lung tissue so badly that it no longer works. So lung function usually worsens slowly over time and can become life-threatening. Respiratory failure is the most common cause of death in CF. So there's bouts of worsening symptoms, which we kind of broached a bit earlier in the post. So people with CF may experience times when respiratory symptoms and worse than usual. These are called exacerbations. So the symptoms may include coughing with more mucus than usual and trouble breathing. Low energy and weight loss are often also common during exacerbations. So exacerbations are treated with antibiotics. So sometimes treatments can be given at home, but usually a stay in hospital is needed. There's complications with the digestive system as well. So there's the poor nutrition, which the thick mucus can block the tubes that carry digestive enzymes from the pancreas to the intestines. So without these enzymes, the body can't take in and use proteins, fats, or fat-soluble vitamins that can't get enough nutrients. So this can result in delayed growth and weight loss and inflamed pancreas, and a condition called pancreatitis is common. So there's also diabetes. So the pancreas, which is what makes insulin, the body needs this to regulate sugar. So cystic fibrosis raises the risk of diabetes. So about 20% of teenagers and up to 50% of adults with CF develop diabetes. So there's also liver disease. So the tube that carries bile from the liver and gallbladder to the small intestines may become blocked and inflamed. So this can lead to liver problems such as jaundice, fatty liver disease, and cirrhosis, and sometimes even gallstones. So there's also intestinal obstructions. So there's intestinal blockage, which can happen to people with CF at all ages. So sometimes a condition in which a section of the intestine slides inside another nearby section of the intestine. Sorry about that. Like a collapsible telescope. That can also happen. So there's also the distal intestinal obstruction syndrome, DIOS. DIOS is partial and complete blockage where the small intestine meets the large intestine. DOS requires treatment straight away. So when it comes to the reproductive system, there's infertility in men. So almost all men with CF are not infertile. The tube that connects the testicles and prostate gland, called the vas deferens, is either blocked with mucus or missing entirely. Sorry, I apologize. All men with cystic fibrosis are not fertile. So the tube that connects the testicles and prostate gland, called the vas deferens, is either blocked with mucus or missing entirely. So sperm is still made in the testicles even though it can't pass into the semen made by the prostate gland. So certain fertility treatments and surgical procedures sometimes make it possible for men with CF to become biological parents. So there's also lower fertility in women. So although women with CF may be less fertile than other women, it's possible for them to conceive and to have successful pregnancies. Still, pregnancy can worsen the symptoms of CF. So there needs to be serious discussions with healthcare professionals about the risks that are involved. So there are other complications. So there's thinning of the bones. So CF raises a risk of developing a dangerous thinning of the bones called osteoporosis. So it causes joint pain, arthritis, and muscle pain can also occur. There could be a imbalance of electrolytes and dehydration. So CF causes saltier sweat, as we've mentioned before. So the balance of minerals in the blood may be upset. So this raises the risk of dehydration, especially with exercise or in hot weather. So symptoms of dehydration include a fast heartbeat, extreme tiredness, weakness, and even low blood pressure. So there's also GERD, gastroesophageal reflux disease. So stomach acid repeatedly flows back up into the tube connecting to the mouth and stomach and is called the esophagus. So this backwash is known as acid reflux and can cause irritation to the lining of the esophagus. There could also be mental health issues. So having an ongoing medical condition like CF, it can, because it has no cure, it can cause fear, depression, and anxiety, and even isolation. So it can affect your mental health. So, check in with your mental health team, talk to people, join support groups. With prevention, if you or your partner have close relatives with cystic fibrosis, maybe think about getting genetic testing done to see if you're both carriers, because as we mentioned before, both parents need to be carriers for the child to have CF. So if it's only one parent, then that child becomes a carrier, but they won't get CF. So it has to be both parents to be carriers, to have that gene, for that child to then end up with CF. So with the diagnosis, as mentioned before, there's now the newborn screening, which is in every state in the US. I'm not sure, I couldn't find much information as to the screening in other countries, because each medical system is different, obviously, and what they have available is completely different. So unfortunately, I couldn't get a lot of information on that one, so I do apologize. But there is the newborn screening. So they take a few drops of blood from the baby's heel. And then the laboratory checks the blood sample for higher levels than expected of a chemical immunoreactive trypsinogen IRT, which is released by the pancreas, which could then suggest CF. And then the levels may also be, IRT levels also may be higher because of premature birth as well, or a stressful delivery. So for that reason, other tests are then done to help diagnose the CF. So it's not just a single solitary test that is done to help diagnose CF in newborns. It just helps to kind of trigger further ongoing tests to help with the diagnosis. So there's also the sweat test. So to check if a baby has CF, they do a sweat test to check, and it's done at about 2 weeks old. And a chemical that causes the skin to sweat is put on a small area of the skin. Then the sweat is collected to test it and see if it's saltier than typical. Because remember, with people with CF, their sweat contains more salt. So then the testing is done at an accredited centre for cystic fibrosis. So it's not just done at any lab, it's done at a lab that is specifically there for cystic fibrosis. And then there's also the genetic testing, as mentioned before, with both parents and then obviously the child as well. And then there's testing of other older children and adults. So cystic fibrosis tests may be recommended for older children and adults who weren't screened at birth. Your healthcare professional may suggest genetic and sweat tests for CF if you have repeated bouts of an inflamed pancreas, nasal polyps, chronic sinus infections, lung infections, bronchiolitis, male infertility. So unfortunately, there is no cure for cystic fibrosis. There are treatments that can ease the symptoms, lessen complications and improve quality of life. Close monitoring and early aggressive intervention is recommended to slow the worsening of CF over time. So this can lead to a longer life. So managing CF is complicated, so it's best to get treatment at a centre with multi-specialty teams of doctors that are professionals trained specifically in CF. So they can evaluate and treat your conditions. So it's also, the goal includes preventing and controlling infections that occur in the lungs, removing and loosening mucus from the lungs, treating and so the goals of treatment include the prevention of controlling infection that occur in the lungs, removing and loosening mucus from the lungs, treating and preventing intestinal blockage, and getting enough nutrition. So the medicines that target the gene change and improve how the CFTR protein works. There's antibiotics to treat and prevent lung infections. There's anti-inflammatories. There's mucus thinning medications. There's medicines breathed into the lungs called bronchodilators that can help keep the airways open by relaxing the muscles around the bronchial tubes. There's pancreatic enzyme capsules that are taken by mouth to help the digestive tract take in and use the nutrients. There's stool softeners to prevent the constipation and any bowel obstructions. There's acid reducing medications that to help pancreatic enzymes work better. There's specific medicines for diabetes, liver disease when needed. So medicines that target the genes. So those for CF who have certain gene changes. CF transmembrane conductance regulator modulators may help. So about 90% of people with CF may be helped by using these medicines. So gene testing is needed to find out which specific gene changed you to have, and if a CFTR modulator may work for that person. So it is a CFTR modulator is a newer medication that many experts think is a breakthrough in the treatment of CF. So the medicines help the CFTR protein work better. So it can make lung function better, it can help digestion and weight, and lessen the amount of salt in the sweat. So there's a lot of different things that are now coming through that may actually be able to help more efficiently. So there are so many things that can be discussed with medical teams to try. And I think some of it will be trial and error, but a lot of it's going to come from genetic testing to see which parts of the genes have been affected as to which treatments they can try. So, you know, there's also things that physiotherapy can help with, so techniques to clear the airways, etc. So there is, you know, there's also pulmonary rehabilitation, there's surgery and other treatments that will happen along the way, like clearing the sinuses, etc. So, you know, at times there could be feeding tubes. And another thing that could be an option as well is a lung transplant or a liver transplant. So there is a lot that goes with having cystic fibrosis. And, you know, another thing that needs to be paid attention to as well is nutrition and fluid intake. So that really needs to be monitored as well because of the effects it has with the digestive system. They also need to make sure that their vaccines are kept up to date, just to make sure that they have that prevention, especially with the annual flu shot and now the COVID vaccine as well, just to give them that extra protection, you know, because they can affect the respiratory system. It just helps to prevent, you know, further complications. So it's also recommended to get regular exercise, obviously not too much exertion. It's just more so just to help loosen any mucus in the airways and to help make the heart stronger. And so it is also recommended for people with CF to stay away from smoke because it can irritate and harm the lungs. So it's also very important that not only the person with CF wash their hands regularly, but the people around them wash their hands regularly. And also making sure that people CF, that they attend their medical appointments regularly. And when it comes to coping and support, like I said, support groups, they're on, you know, there may not be many in your area. There could be some that, you know, you can find online. You know, you can see a psychologist, you know, have that one-on-one, be able to have a chat. There's so many options to be able to get some support so you're not on your own. You know, and another option as well, preparing for an appointment with your medical specialist, is writing down any changes that you've noticed, etc. So yeah, so there are options as well. So there is a lot that goes along with CF. It is quite difficult. So thank you for sticking through that with me. It is quite difficult, CF. It was actually requested by one of our members. So on Patreon now, you're going to actually be getting a lot more when it comes to awareness posts. And anything you'd really like for me to cover, you can request. Basically, if there's any particular type of video or something you'd like for me to cover, shoot me a message. You know, we can have a video one-on-one and have it recorded and have it posted, so we can kind of have that Q&A. We can have a conversation about something. There's so many things that we can do. So you know, it's not just about the awareness posts. You know, we can have chats to each other. you know, to try to break down stigmas, you know, to talk about personal journeys. You know, there's so many different options which, you know, I really want to cover in Patreon, you know, and get the information out there, you know, and help make people understand. Sorry about that. One of the pugs has decided to lean against the post. So yeah, so I would love for somebody to come along and do a video with me, and we can have a chat with each other. So if you're interested in coming along and doing a video with me, send me a message. Love to have a chat. Stop hitting the post, dude. So yeah, and welcome to Patreon. And also we have Discord, so check out the Spoony Life and Beyond. We have a Discord, and I will see if I can put the link up so you can come along and join us in Discord, where we have lots of fun. We support each other. If you're having a bad day, let us know. We'll have a chat. You know, you can have a chat with me one-on-one. You know, there's other mods you can have a chat with. There's other people in the community you can have a chat with. So come along. I'm going to post the link to the Discord. So check it out. All right. Thank you for listening. Bye.